Right. Welcome, everyone, and welcome, Judith. I'm going to let you start and introduce yourself to the community, and then hopefully share your screen and share your presentation with us.
All right. Thank you very much, Maren. So hello, everyone. Thanks for joining us today. And I want to thank the Northwest Parkinson's Foundation for having me. I love to share with you. So what we're going to be sharing today is I put together a PowerPoint with some videos of the equipment that we have here at the office. And so we're located in Bellevue at the corner of Northeast 8th and Northeast 140th Street, or Avenue Northeast. So it's pretty close to some of you and within driving distance for some others. So we're going to go ahead and bring up the screen here.
You just press the green button. Wonderful. Thank you.
There we go. All right. So is the white box in the middle for you guys? There we go. Now we got rid of everything. Oh, and there's another person to admit. All right, so this is I titled it Hope and Being Active, because I'm a firm believer. Oh, I'm sure most of you have read the book Hope, which I really enjoy reading and sharing with my clients. And then being active, I think that's one thing all of us as we get older, we just, we need to remember to stay active. So the things that we do at the clinic is in order to help you along so that you can do more things at your home and with your loved ones. So again, the address is here. Also our websites, we have 2 of them, and then my email is at the bottom. So you'll be able to look at all that information. So we're going to talk for a few minutes and show some videos, and then we'll go on and I'll get questions and answers at the end.
Go outside.
Okay, so why is it not advancing? It did just, here we go. All right, so this is our team. So we have physical and occupational therapy at the clinic. So on the left is Beth McMoran, who's the physical therapist. And then the other person leaning forward to look at the screen, like I spend a lot of time doing. Where is that button? That's myself.
I'm sorry, Judith, I don't see your screen. Does Marcy, do you see Judith's screen, the PowerPoint? You can.
I can see it.
Oh, you can see it. Okay.
I can see it. Sorry.
Okay, that's fine. Sorry, I just wanted to make sure that everyone can see it. Okay.
Oh, Maren, you can't see it?
No, I think it's because I might be the host, and so I'm trying not to pin myself. Sorry.
Oh, okay.
Okay, as long as everyone can see it, I'll let you go ahead.
All right, and then I'm assuming the pictures are not on anybody else's but mine. Is that correct? So you see the whole thing, Marcy? Okay.
I can see your face and the PowerPoint.
Oh,
Yeah.
All right.
Yeah.
So
Good.
Excellent. So the agenda is the 4 things that we do at the clinic. So one of them is myofascial release, and I'll get into that a little bit more. And there's also a website I'm going to share with you. But myofascial release is a technique that's used to allow the fascial system of the body, which is our connective tissue, to be able to be more useful. And the fascia doesn't know normal. So when we do something or we lose the ability to do something, the fascia comes in to support and protect the body. And by doing so, the muscles shorten and it becomes harder to do things. So the technique is a hands-on technique where I place my hands on different parts of your body, telling you beforehand, in order to allow that connective tissue to loosen and lengthen to free up your muscles so you don't have to work as hard to use them. So we're going to talk a little bit about that. And then we also have one of the few balance tutors or perturbation treadmills in the area, which is a regular treadmill. However, it has a climbing harness that you wear on it And then you also are allowed to have perturbations where the whole platform moves side to side and also can provide a slip and a jerk. And this was a machine that was developed a number of years ago in order to assist decreasing falls. And so we have found that by about 4 to 6 sessions that people have a tendency to be able to accommodate their bodies better and be able to catch themselves when they start to fall so that you don't go down. And in the research that they've done, they found that the chance of breaking hips is less after using the machine and being able to know how to fall. So it's almost like, you know, stop, drop, and roll when we're in a fire. Well, this is, you know, our body automatically remembers that when we start to go down, we almost, you know, catch ourselves as a judo roll. So it's a way to practice that so that your body learns that better and also learns to have better proprioception, which is our ability of where our body is in space. So we're going to go through a video of you watching me use that. Then we also have biofeedback devices, which is both a robot arm or a glove that goes on and is allowed to provide just a trace of movement. So if you start losing ability to pick up your coffee cup or pick up your spoon or hold on to things while you carry them across the room, this glove that goes on helps to retrain the brain again and allows it to be able to grasp things and know that it's grasping things. And then we have both a glove and also a little device that looks like a 3DT, which you'll see in the video, kind of like a Fitbit. And with that, you can work on balance. So a lot of times we have trouble finding our center of gravity and we tend to walk forward a little bit. So our shoulders are forward of our hips. And so this is a device that goes on, and by just slightly moving the body forward and back or side to side, you're able to retrain your brain to find that center of gravity. And then you do activities that are on the computer. So it combines both a game and an exercise in order to improve it. And then almost 3 years ago now, I bought a device from a company called Reflection, and their website is reflection.co. And what it is, it's, and you're going to see this in the videos too, it helps to train our eyes, both central vision and peripheral vision are looking off to the side, so that if you're still driving, if you're out walking, you're able to be more aware of your environment around you. And then there's different activities that we can use if you're having trouble with inhibition and you just react to something and you can't stop yourself from reacting to it. It helps to retrain that part of the brain so that you can know what you're doing when you start to do it. And then also left-right tracking skills, so it improves your ability to continue reading, and speed of performance. So if you think that, you know, you start to do something and then you kind of freeze in space and your arms and hands aren't able to reply, you know, to respond and be able to do it, then it helps to retrain that part of the brain and speeds up that speed of performance. So they started out using it with athletes, and so it's in a lot of the training rooms with a lot of the professional athletic teams. And then a balance center in Chicago got one, and they started using it. And so now we have one in the Pacific Northwest. And what I like to do after I present to all of you is that you can come for a free session and trial anything that you're interested in. And then if you do want to come for therapy, you can continue on. So topic 1, we're going to do the myofascial release. So typed out this part so that as you're watching the PowerPoint later and refreshing your memory on it, it'll give you some information. So most of this I've already told you. But the big thing is that even though we have a diagnosis, we don't want it to, you know, say who we are and define who we are. So we want to still be active in activities and to keep our bodies active. And I'm sure you've heard as you were growing up, if you don't use it, you'll lose it. My mom used to say that all the time, and I was just like, well, I'm using it all the time. What do you mean? But now as I'm getting older, I realize that it is very necessary to keep exercising and using our body. So again, I just reiterated the details of the fascial system, that it is continuous through our body from our head to our toes and the front of our body to the back of our body. So it's three-dimensional. And it actually encircles every nerve, every blood vessel, every artery, every organ, every system, every part of our body. So our fascia maintains the ability throughout our lifetime to change due to the neuroplasticity of our brains. And again, I put that in for you, that the fascial system surrounds every nerve, blood vessel, muscle, and is truly our consciousness. So when we're not able to use our bodies as well, the fascial system adapts and it gets harder to move and our muscles shorten in length. So if you go to try to bend down to touch your toes and you can't do it and it pulls in your back, a lot of times that's due to the fascial system shortening and tightening. And so through a hands-on technique, the collagen, which is one component of the fascial system, is able to soften and lengthen, and then that allows our muscles to start working. So take, for example, on the top of your thigh, you've got 4 quadriceps that go across there, and they're supposed to work individually to help our leg be able to move as we flex our hip and as we move forward. And what happens when we haven't done it for a while, those 4 components of the quadriceps start growing together and then they start moving as a bundle. So it takes a lot more energy and effort to move than when they're separate and can move individually. This is one of our treatment rooms where we would do the myofascial release. So you lay on the table and it's like going to a massage. Some people leave their clothes on and I just ask if I can touch their stomach area, their chest, their sides of their ribs, whatever area we're treating. And other people prefer to disrobe like they're at a massage, and then it's easily accessible for whatever we need. And each day treatment is different. It's all individualized. So we see what's hot, hard, or painful on that day, or what you're having difficulty doing. And then we find where that cause might be coming from and work on that area of the body. And this is a website that's available that has some articles about myofascial release. So I put this on here for you so you'd be able to go on and read some articles. So Walt Disney once said, the way to get started is to quit talking and begin doing. So that's what I'm hoping all of you will do, is just keep doing things to keep yourself as strong as possible and as functional. So we're going to see a presentation now of me on the balance tutor. And so all of you can laugh, because when you're trying, well, my husband was filming it at least, so I wasn't trying to film it and do it, but I'm sure you'll have a laugh as you watch. So this is the balance tutor. The safety tape is around it because as the platform moves, it has the capability of moving anywhere from just ever so slightly to over to where you see that yellow line. So again, it can be graded for where you are and what's best for your performance.
I'm not hearing anything, so maybe you can narrate.
The volume is not coming on, Judith, for us.
Uh-oh.
Sometimes it does that when it's a video in the presentation, but maybe you could just...
Okay, so I'll just tell you as you're watching it. I'll just assume you're not hearing anything and you're just watching. So that's the safety harness that we put people in. And I'm going to demonstrate in a minute what happens if you would lose your footing or slip. So you're fully supported. Some people will simply put a foot off to the side and just step off like I did right there. So the treadmill can run from 0.1 miles per hour up to 7 miles an hour. So we started slowly, and then I ask you if that's your normal walking speed or if it's a little bit faster than what you do, and then we can slow it up or speed it down. So as you can see there, I'm walking along and that's at 0.8. And then I'm going to speed it up a little bit as we go along. So you'll see it going a little bit faster. And then the perturbations can be set from, again, 1, which is, you wouldn't even feel it move. It's more of a vibration on the screen, up to 30, which would take it all the way over to that safety strip that you saw around the outside. And generally, I'll start at about a 5 or 6. So that it's, if you were walking along and you were talking to someone next to you and you lost your footing a little bit, it would give that sensation. You have a screen that you watch. You can see there in the video where you can see that. And then that way you can keep your feet on either side of the platform as you're moving. And you are able to have your walker up there with you, walking sticks, canes, whatever you're using presently to walk. It's allowed while you're walking on the treadmill. Now you can see I'm going a little faster. And it's interesting, my friend in Toronto wrote a book about I can run, but I can't walk. And it's so true that many times our brain is able to process faster when we're walking at a little faster speed. So as you build your confidence, then, you know, I'll speed it up a little bit. What's the worst that can happen? We slow it down again. So you're very safe and, you know, no danger of falling or anything. And also on the screen, I don't know if you can see off to the right in the blue, there's a lighter blue right in the middle. And that is actually how much weight you have on each foot, so that I can see whether you tend to put more weight on one foot or the other, and then we can adapt it. And also as you're walking on it, I can watch and see if when it slips forward, you're always catching yourself with the same foot, then I can simply make it so that the perturbation comes when your other foot is forward. So you have to catch your foot on the foot that you're not as comfortable with. So again, it's all individualized for you, how you are that day. And then we move forward from there. Whoop. There we go. We'll escape from that. There. All right, so then the next device, and just kind of jot down your questions and I'll take the questions on all the things at the end. So the next thing we're going to see is the cognitive awareness device. So again, I'm going to assume you're not going to be hearing anything. I'll work on why the volume's not working. So the device itself has been downloaded onto the iPad. So you each have your own criteria that you follow, your own games. It keeps track of each time that you're here, then we can compare it to previous times as you go along. I get this off. I don't know why there we go. So let me just fast forward this a little bit here. And I was just telling you all that I just told you in a shorter period of time. And again, you could be sitting or standing. So if you're more comfortable in your wheelchair, it lowers to come low, or it goes as high as, I've got clients 7 foot tall that use it. And again, it can be adapted if you're not able to use both hands for some reason, but in most cases, I find my clients with Parkinson's really enjoy using both hands because it gets more equal use of both hands together. And that tells you how many milliseconds it took me to do that. And the number of activities that you do can be varied from 5 up to 50. And this one has 2 colors on it. And so your left hand always goes for the same color, and then your right hand always goes for the same color. So again, it helps to retrain our brain to be able to remember, okay, I've got both fingers on, but there's yellow, so my left hand has to move. And so it helps retrain our cognitive ability. And there's a large number of activities that we can do on that. So we'll pause that. And then the next item is the robot glove and the 3DT that we're going to talk about. So again, it's on the computer. So you're going to see the glove go on in a minute. See if I can fast forward that a little bit. Any of you that can lip read, you can read. I turned my volume up. I don't know why it's not.
Sometimes it just doesn't play in a PowerPoint, Judith. It's just the way it is.
Gotcha. It's not human error here. So again, you could be sitting or standing. There's different size straps, so it fits your leg. So this is the Fitbit part to work on your balance. So that little device can go on an arm. It can go around your head if you're having trouble with your head dropping and you want to work on being able to keep your head in midline. It also can go around the trunk like we're doing here to work on balance. It can go around the top of your leg to work on your hip, around under your knee to work on your knee, down on your foot to work on being able to lift the ankle up and down to improve your, if you have dropped foot or something, to improve the mobility in your foot and ankle. And here again, there's a individual program for each person. So you go in and you click on that, and then you click on here. And the nice thing about using these devices is that if you come in and you see that it is something you would benefit from, then you're allowed to take a device home. And each device is $2,000, but as long as you're coming for therapy, you can have the device at home. So you can use it for 5 minutes, 10 minutes, a half hour a day in order to improve your skills. Because a lot of times it's easier to use things for a shorter period of time so that you don't get so exhausted in that. And when you're in the clinic, you know, I'll put it on for 10 minutes or so and you get really tired. So it has a library. It shows you exactly where to put it. It shows you how to change if it's on an arm or a leg and you have it on the opposite one. And then all of these games are available. So some of the games have a busier background. Some of them are less integrated and less abstract, so that it's easier if you're having difficulty with busy screens. So the one I'm doing is called Flying Turtle. And so it is relatively busy. There's clouds in the background and there's bubbles that are going to be forming. And then by moving my body forward and back, and again, it can be just the slightest, smallest movement that it can pick up that we set when we do the initial setup and the movement. And then as you move forward, it moves to the left or right. We can change that. If your brain thinks if I move forward, I should move to the left, and that's how we'll set it up. If your brain works that when you move forward, you should move to the right, then the screen can be set up that way. So again, it's all very individualized for each person. And it can also vary, like I've got this set on 5 seconds that I'm staying on the side, and then the bubbles will start moving across the screen. But that also can be varied where you may need to stay 20 seconds to do that whole side so that you don't feel rushed and it doesn't become confusing to you. I was just listening to make sure I told you everything I told you in there, and I did.
I'm glad you're correcting yourself.
Oh. So then what I also put on here for you, let me go back here now to full screen. So this is a spinal nerve function. And so it's a chart that's available. So if you just either shoot me an email, which my email will be, it's on the first slide and also on the last slide. But this is spinal nerve function. And so it tells you which part of the spine contributes to different organs in the body. And most of my clients just find it really interesting that if we work on a particular area, then they see a change a lot of times in the function of that organ. So again, it can be individualized that if you're having elimination problems or frequent urination or just back pain, leg pain, headaches, vertigo, any symptom that you may be having, you're able to look on here and say, oh, you know, that section of my back may be contributing to that problem. And then we can spend a little more time on that area, or where I may touch and you'll say, oh, you know, you're on my psoas, which is from your lower rib down to the inside of your groin, but you may be feeling it in your ears or in your head. And so again, it's all individualized to what your body is responding and what you're feeling that day in yourself. And then another chart that I put on for you is this one, and this shows the organs on the left. And then again, it goes in and shows you what is related in relation to that organ. Be it in the brain or along the spine. And this chart is also available. I have sheets that you can have one if it's something you're interested in at home. Then exercises. Yoga is one of my favorite things to do. So what I did, this is focus exercises. So if you find yourself having difficulty keeping your mind straight, or if you're having difficulty reading because you can't, you know, concentrate on the page, or if you watch the news or a TV program and you can't share it with your loved one and that because you can't remember it. Sometimes these exercises just help to trigger that part of the brain in order to utilize it. So it's the tree pose. And again, you know, they've got their hands here, but we can modify it where you can finger touch the wall and then lift a leg, so that if you do start to fall, you fall into the wall and you're holding yourself so that you feel safe trying to do some of these. And of course, the warrior pose, same thing. They've got their arms up here, but you may need to finger touch and then be able to move your legs apart. So again, it's all individualized. Figure 8 is one of my favorites. So you stand and you make a horizontal figure 8, and then you can use the other hand. Or you can use both hands together, clasp your hands and bring them here. And again, that slight little movement triggers focusing your center of gravity and getting your head over your shoulders over your hips over your feet, so that your sense of stability is better when you're moving through space. And here's some stretching exercises. So again, putting your hands up and then just being a moon. Going to the side. The next one up there is the twist pose, a little bit trickier, up on one foot, and then you're twisting your whole trunk. Again, we can modify it. Both feet can be down and you can twist. You can find your own modifications, because I know all of you are very active doing boxing and dancing and Tai Chi and all the things that you do. So triangle. A little more challenging. You lean forward and then put one hand up and one hand down while you're leaning forward. Again, you can modify it in pieces. The chest stretch that you see in the middle there on the right-hand side is one of my favorites. So you're standing and putting your arms behind you, pretending that you're pushing something away. And this helps to open this whole upper chest and shoulder area. Because so often as we're sitting more and doing less, we tend to start kind of shrugging our shoulders forward. They start coming in, then our arms start coming in. And when we go to reach for something out, this doesn't move as easily because it's tight. So we can either do one of the hands-on techniques to help open that whole area so the muscles aren't as tight, and then follow it up with some of the exercises. So on the bottom is another lunge, a little different from the warrior. And then again, the back stretch, just putting your arms up and then just leaning your arms behind your shoulders. And that gives you a little bit of an arch in the lower part of your back so that you can start using those extensors. Because as we start getting where we're not using things as much or being as active as we were when we were, 20 and 30, then all of the body, gravity starts pulling us forward into more flexion. So the more things that we can do at extension, the better it is to keep our body more mobile and not have as much pain. So one thing I want you to remember when you start doing an exercise, if it feels like you're moving through water, keep going. If it suddenly feels like you're stuck in the mud, bring it down just a little bit and then do what's called an eccentric contraction, where you're reaching forward as though you're pushing something away. And then you'll start feeling that opening up that back part of your upper part of your back and allowing you to have more mobility. Oh, no, I don't want to see the news right now. Thank you. There we go. Don't you hate when those things come up on your screen? I do. Then I also included a foot chart for you to just kind of have for your own things. I wasn't standing very straight when I took that. Sorry about that. Our feet have every organ of our body, a point on our foot that contributes to that organ. And not only that, but our feet is the only part of our body that whether we're standing, sitting, lying, squatting, kneeling, any position, some part of our foot is in contact with the surface. And so many times our feet start hurting and we're just, we can't lift our toes as easily. We can't wiggle them as easily. We lose our mobility. We don't feel like our ankles are moving when we start to go forward. And so that slows down our gait pattern and makes us walk with a shorter stride length and just not be as stable when we're standing. So I just thought you might find it really interesting to see what actually was on your foot. And when we take a hold of it, what we're actually looking for. So I just thought I'd share that with you. So now, this little ball that I have in my hand is one of my favorite things. So when you have that point in your body where you've just, no matter how you move, you can't get that crick out of your neck or you can't get that little discomfort out of your back, you can take this ball and you get one when, if you come for treatment, that's one thing that's given to you your very first treatment. And you can put it like on your back, lay down on the bed and just lean into it. So I'm going to show you here in this video. So some of you may have, at your physical or occupational therapy, have already used a ball or a roller. And I have the posters up of using the roller, but a lot of my clients go, oh, that roller is so hard, it hurts so much, and they just really complain. So I find if they use a ball in a little smaller area, they're a lot happier. And again, if you can't reach back to put it yourself, you can have, your caregiver, a loved one, or whoever's with you help. I have one client that actually taped it to their wall, so they just walk over to it and then they can lean into it. So. And then you can move or you can just stay on it and just use it. This is one of my favorite places, is in the middle of the buttocks. That's our piriformis muscle. And so you just put it there, and then you can just press into it, or you can roll on it a little bit. You can lay on the bed and do it. And those of you who may be experiencing some low back pain, we found through studies that there's 3 P muscles that contribute to about 90% of our low back pain. And it's the piriformis, which is what I just showed you in the middle of your buttocks. It's your pocket muscle where if you wear pants, that's where your pocket is. Let me stop this for a minute. And then the other one is your psoas, which goes from up under your ribs down along about, usually on most people, about 1.5 to 2 inches lateral to your belly button. And it goes all the way down to the inside of your groin. So if you feel like you're being pulled forward and you're having difficulty straightening yourself up, a lot of times that psoas, because we haven't used it as much as we used to, has shortened a little bit. And so that tends to pull us forward. And then our back starts arching, our shoulders start coming forward, so they're in front of our hips, and makes it more difficult to walk. So the psoas becomes your best friend when you're getting myofascial release, because after it's released, then you feel like you can stand up again. And people are like, I can breathe better. So breathing's another thing that the ball really helps to open up, because a lot of times we start breathing real shallow, where we'll breathe at the top of our chest as opposed to using our diaphragm. And so those of you that just put your hands on your chest, and when you take a deep breath, what do you feel move out and expand? Is it the top hand and you're a shallow breather and breathe at the top of your chest? Or is it the hand that's down at your diaphragm, right above your belly button at the lower part of your ribs? And when you take a deep breath and inhale, does it come out? And then as you exhale, go in? Or when you take a deep breath, do you feel it going in and not being able to expand? And sometimes that difficulty just simply comes because, again, if we haven't used it, that fascia system has come in to support and protect that diaphragm. So it's laid down extra fibers. So it starts overlapping and becomes more difficult to move. So by doing the techniques, those fibers start to lengthen and come out so they can work again and give us more mobility instead of being so tight and twisted. So, oh, not bad, 20 chill. So I hope this presentation has been helpful for you, and we really look forward to having you come and participate with us at the clinic. If you just want to come and visit, feel free to call and make an appointment to do that, and we'll just show you everything. And if you want to start right out coming and experiencing it as a client, we'd be happy to do that. And then I want to share with you one of the research technicians that I work with, and one of the doctors in the country are planning on doing some research on the balance tutor this year. And so clients that come to our clinic are going to have the opportunity to be in that research. And it was designed, get my notes here that they just sent me. They're going to compare the reactive response movement ability in Parkinson's disease compared to healthy adults. And with the development then of the perturbation-based outcome measure in your standing and in your walking or your gait, then they're going to be able to differentiate between individuals with Parkinson's and individuals that have not been diagnosed with it. Then they're going to set up a protocol of reactive response, again, just to keep track of all the data and that, so that we can contribute to all the research, because the fascial system's been basically ignored through all the years. My reference to it, even in therapy school, was in cadaver lab, where they would tell us to unzip the bag, take the scalpel, make a slit. We'd see some white stuff, get it out of the way, and find the nerves and the muscles and origins and insertions. Well, now we're finding that that white stuff is what gives us our form. So one of the studies that was done at the University of Southern California was that a man took 2 cadavers, and one of them, he took out all the white stuff, and he just had a blob of epithelial tissue. And then he took out all of the muscles and nerves and blood vessels out of another cadaver, and he actually had form and substance to that body. So that's the importance of the fascial system, and it never gets addressed because we were trained to treat symptoms. We were trained to treat in the area where the symptoms were. And quite often the cause of our problems or our pain is from somewhere else in the body. So that's one thing that we really do is we look, you know, where do you feel it from? And some people, you'll be working in an area and, you know, they'll say, oh, I felt that in my foot, or I felt that in my head. Or people who have headaches, they're like, you know, my headache went away, but you didn't even touch my head the day that it went away. So it's just always an experience in that, and usually an enjoyable one. Occasionally the body will go into a little bit of chaos and it'll be a little worse for 1 to 3 days after a session. And then I get a phone call of, you know, what'd you do? What happened? And I just explain that, you know, the body has to sometimes go through that change in order to reorganize and balance and make a quantum leap of improvement. So that's what we'd like to share with you if you decide to come and join us. So now I'm gonna, I think Maren has to open this up to questions and answers. So
Yeah.
I am free for any questions you guys have.
Well, thank you so much, Judith. That was always, you know, we learned so much from when you give us a presentation, and it is so cool to be able to see those machines. And I'm so glad you were here to be able to narrate to us. Does anyone have any questions? Would you like to put your hand up, or yeah, Laura? I'm going to ask you to unmute yourself because you're muted. We can't hear you, Laura. You need to.
There we go.
Perfect.
How does one go about making an appointment to test this out, or make an appointment if someone feels they want to go forward with this?
Okay. So that information is on one of your slides, but I'll just give it to you now so that you can tell, I think.
We'll get you the email for Judith.
Okay, so the phone number to call is 425-531-9886. Or you can shoot me an email at jrp as in Paul at MED as in David, IT as in Tom, C as in Charlie.org. So again, that's jrp at MEDITC.org.
Oh, actually, sorry. I think I put MediTouch. Is it JRP at Medi? Oh, sorry, that's just a waiting room. I was trying to put the phone number in the chat. For you. Okay.
Okay, yeah, it's JRP at MEDITC.org.
JRP at MEDIPC.
T as in Tom.
Oh, TC.org.
Yes.
Okay, now you should be able to see it. JRP at Medi, and your phone number is 425-531-9886.
Correct.
And of course, everyone, you can get Judith's email and information through me or Dr. Marcy or through T and Pam as well. We're always happy to connect to our speakers.
I have one more question.
Yes,
the edge cognitive games you were playing, what is this? What is the purpose of that, and what does this determine? Is it making a determination, or is it therapy to work with the cognition?
It's therapy to work with the cognition. And so what we're finding is that they're finding with Alzheimer's patients now that, and dementia especially, that we're getting a 65% increase in the length of time between the beginning phase of dementia and the intermediate phase. And so by adding the edge, we're hoping to increase that to a 75% improvement in increasing that length of time between the beginning phase of dementia and the intermediate phase. So, but it does central vision, which is looking straight ahead. And then by keeping your head straight ahead, then you'll have lights off to the side. So that builds our peripheral vision, because a lot of times the peripheral vision is something that we lose first. And so then it also does eye-hand coordination activities, because sometimes we lose the ability for our hand to do what we want to. So we may be reaching for something and overreach or underreach and not be able to make contact with it. So it helps with that. The other thing is impulse control, that a lot of times we get a little, have a little more difficulty as we get older at being able to, for the inhibition to work. So it has an activity that we can do to help build that impulse control and improve it. So,
Thank you.
yeah. And the website to be able to see it in action is Reflexion. It's REFLEXION.co. And be sure you do that, or you'll get a site that you might get arrested for watching.
Oh,
Why
dear.
they picked one so close, I do not know, because I messed up once and I put like the other, like we usually put. Don't do it.
Oh my gosh. So reflection, I put it in the chat. Is that the correct spelling? REFLEXION.co.
I'm not seeing it in the chat this time where it was.
Oh, should be.
But yeah, it's REFLEXION.co.
Okay, I did get that.
Okay.
I'm seeing it.
Okay.
Good.
I hope you're seeing the right thing, but
Yes, me too. You'll only make a mistake once.
I think Kathy has a question. Kathy, would you like to unmute yourself?
I think I did.
Yeah.
All right.
Okay. My question is, and I didn't come in for a couple of minutes when you first started. I've had a number of falls. They've all been forward, and I've been able to catch myself with my hands or skin my knee. But I keep reading that it's better to fall backwards. Is that what you say?
No, not necessarily, because if you fall backwards, if you do catch yourself, it's more a tendency that you might fracture your wrist. And if
Yeah.
you don't catch yourself, then it's more of a tendency you might get a concussion from hitting your head.
Okay.
So no, if you're gonna fall, yeah, forward is a little better. You can still fracture the wrist, but you don't have as great a chance of hitting your head and getting a concussion.
Okay. Thank you.
I thought I saw another hand go up.
Is there anyone else? If you'd like to put a question in the chat, I'm happy to read them out. No,
Carol
I
is
have.
raising her hand.
Oh yeah. Sorry, who was Carol?
Fred, I believe.
Hi, yeah, Carol Lacani. I missed the first few minutes too, because I was setting up my husband for his meeting in the other room. And is this a new kind of therapy for Parkinson's that we're talking about? Because I missed the first 10 minutes, I think.
It's relatively new. The balance tutor has been around since about 2016.
Okay.
And it was kind of interesting how it was developed. A senior physical therapy student went to Walmart, bought a treadmill, and then made it into the perturbation. And so he did it for his senior project, and then he just offered to sell the prototype, and this company picked it up and proceeded to perfect it. And then they got it FDA approved. And so we were the second one in the United States to get one, and still one of the few that are in the United States. And the one on the East Coast is research only. And then the one in Montana is a vestibular center also that deals with anyone with vestibular problems. So yeah, it is relatively new. And when you go on, like if you, I think Maren recorded everything. So there's a slide that lists our websites, so you can see the balance tutor in action a little bit more.
And where is your office located, or your therapy?
We're in Bellevue,
Oh,
and we're
okay.
at the corner of Northeast 8th and 140th Avenue Northeast.
Oh, okay.
Is that near the Safeway? Like, would you like to give people a bit of
It's
a
by the
landmark?
Parkinson's Project, right? By Parkinson's Project, the same building?
Are you by
It's not
Nate?
the same building, but I believe it's across the street.
Okay, okay.
But yeah, we're just, the Safeway is at Bellred Road in 140th, and we're just about 3 blocks down. A lot of our clients will walk to the Safeway if they
Okay.
get dropped off early in there.
Okay, okay. Thank you.
Thank you, Carol. I think, did someone else have a question? Yes.
Yes, Laura?
Yes, Laura, and then Pat.
I'll make
No,
it real
first
quick.
Laura.
I'm just assuming insurance pays for all of this therapy. It's
We do,
approved
yeah, we
Medicare.
accept all major insurance, including Medicare and Medicaid, Washington Apple Health, Regions Primera, Cigna, LifeWise, Aetna, pretty much all of them. So some of these Medicare Advantage plans that people are getting on now, we're having to get credentialed separately from. So Primera just grandfathered us in. Some of the others we're still working on credentialing as they add that. But the majority, yes, they do pay in network.
And do you have to be referred by your neurologist, or can you
That
just?
depends on your insurance. Some of the insurances, I have to have the name of a primary care physician if you do have Medicare. But then some of the insurances will require a prescription from your physician, and other ones will just require me to get a prior authorization.
Thank you.
And most of them, well, it varies from insurance to insurance, but most of the time you get 21 to 30 visits a year.
It's wonderful. Thank you. Pat, I believe Pat had a question. Would you like to unmute?
That was my question also about the payment or how that would work. But if you
Yeah, we have a private pay and a sliding scale, but in most cases, knock on wood, we've been lucky and insurance has paid for everything. It's billed out as physical or occupational therapy, depending on whether you see Beth or myself. So, and if you know of any therapists that are looking for a job, we're looking to hire another PT and another OT. So
Okay.
if
Good
you
to
run
know.
across any.
Thank you.
Any other questions? All right. Thank you again for letting me share with all of you, and I hope to meet some of you.
Yeah, and again,
Thank you very much, Judith.
thank you, everyone. I totally agree. She deserves a round of applause. And thank you, Judith, again for coming back. And I have recorded this. I'll share this with your support group leaders. It'll be a YouTube link, which will only be shared privately within your 2 support groups. So if you want to watch this again, please always reach out to us with any questions. We're happy to connect you. You can always also reach out through Dr. Marcy or through T and Pam. And thank you again for joining us for another educational opportunity. And thank you, Judith, so much.
Thanks, Maren. Talk to you soon.
Thank you. Bye-bye.
Bye.
Bye.